In this edition of Ask the Doc, I will cover a common question I get on if a weak core can lead to low back and sciatica pain. Expect to learn the following: why all back pain isn't just simply sciatica, what causes the core to be weak, how to determine the source of back pain, how do you get proper treatment that lasts, and when is the correct time to strengthen the core. For those of you that don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert specifically for neck, shoulder, sciatica, and hip pain. My focus is on finding and fixing adhesion, also known as scar tissue, and reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long lasting pain relief. Back at it for Ask the Doc. Just a quick reminder, if you have neck, shoulder, sciatica, or hip issues and you're struggling to get some real answers as to what is going on, you can submit your questions directly to me. And if my insights can help, I will be sure to get a video out to you. So, first off, why all back pain isn't just simply sciatica? It just gets thrown out there a lot in society when people have low back pain. Anytime it hurts, basically anywhere in the back, down the glutes, down the hamstring, into the foot. They're like, I got sciatica. The problem is, it doesn't tell us the whole picture. We need to know exactly where the problem is and what is causing it. Sciatica is just what I call like a junk box diagnosis term. It lets us know that there's a problem, but it doesn't give us a tissue specific problem because you can't fix a problem in the first place if you don't know where it is or what's causing it. So, what actually causes the core to be weak? I use the parentheses as I do that, weak, because the core doesn't just decide one day that it wants to be weak. There's this idea of what's causing a problem and what is an effect. So essentially, what happens over time with bad postures, accidents, sitting too much, all sorts of things, the muscles in the low back, they get overworked, they get overstretched. They don't get enough blood flow and they don't get enough oxygen, which in turn sends a signal to the brain, and the brain thinks there's actually an injury there. So it starts to lay down all this glue stuff. It's basically collagen that became adhesion and scar tissue, and it makes the muscles weaker and less flexible. Now the muscles can't do their job, which is actually to support the low back, specifically the joints and the disc. So it puts more pressure on the discs and the joints. And then when the discs get inflamed and they cause problems, it causes a lot of issues because it can mess with the nervous system and cause a lot of problems. So a lot of times when the core is presenting as weak, it's actually trying to unload that area and take the pressure off of there. A good example I give is when you sprain your ankle, your body knows to limp. The reason it's doing that is because it's trying to not load that damaged area. And that's what's happening as well. So, this idea of the core is just weak and you need to strengthen it doesn't tell us anything. We must answer why it's weak and why it's tight. And the idea of, well, you just need to stretch more and strengthen isn't the case. If that was the case, so many people wouldn't have back problems. You'd have everyone on Instagram and Facebook and YouTube showing you all these stretches and exercises to fix the back problem, but it's not. Back pain is like a $50 billion industry because we're not getting to the root cause of what's going on. So, how do you determine the source of the back pain? One thing I always ask is it worse with sitting or standing? And a lot of times, what happens is when it's worse with sitting, there's a lot of adhesion that builds up in this muscle that I'm linking up right here. It's called the multifidus group. It's basically runs right along the spine. It actually starts at the tip of your sacrum and goes all the way up to the top of your head. It's really important in stability of the muscle, keeping support. Think of the multifidus as like, say you're going to push a door open, it basically creates like a counter force in your back when you're pushing to keep it from going there. So what happens over time is when you have a lot of that adhesion and it builds up, your multifidus can't do the job. So it puts more wear and tear on the joint in the disc as well and causes a lot of that more severe back pain when people have injuries to the discs. They have all sorts of problems, impingement, possibly stenosis, because it started in the multifidus in the first place. So, what you want to do is you want to get proper treatment that lasts. A lot of people say, oh, you just need to stretch more, strengthen your core. Don't listen to those people. Those people are morons. They don't have an idea of what's actually going on. They're just giving you generic advice. Once again, we have to understand why it's tight and why it's weak. And once we identify where that motion is restricted and that area is jammed up, we can get in there and actually break down that adhesion effectively without drugs, injections, or surgeries, which increases range of motion, blood flow, flexibility, and overall functioning. So what I want to link up in the video now is a detailed treatment demonstration of me treating adhesion in the multifidus spine. So I'll link that up right now. We're going to sink straight in. We're going to back out a bit, and then our tension is going to be that lean with our knee and pushing through that back leg and letting it come up to me. So we found the area here, and what I do is I'm able to get in there backed up with my thumb, just like that, and then I'm going to take the other hand and I'm going to sink in right there. I'm going to be just inferior to it, and it's going to be internal slide. It's going to come to me. So the first step is, come back up for me a little bit. The first step to get our depth is we're going to sink in with our sternum straight down, and then we're going to back out a bit, and then our tension is going to be a lean with the body. And then the client's going to come up through that motion nice and slow, and you're going to let it come up to you just like that. So a couple take homes from the treatment. You can see it's very precise, it's very focused, and it's very deliberate. You know, a lot of times people get treatments and they just kind of beat the crap out of the area, and they actually do more harm than good. We want to get just the right amount of treatment. Treatment is like a medication. We want to get it just right. If we do too much, we can actually flare it up. And lastly, when is the correct time to strengthen the core? First thing is you have to get the tissue healthy and restore range of motion. So getting that treated by a quality manual therapist that can actually identify, find, and fix the adhesion is the most important thing you have to do first. Then once we do that and we restore range of motion, we do need to build back up the posterior chain, which is essentially your hamstrings and your glutes. They're very important in back stability, function, and movement. They tend to be very weak and just turned down when there's a chronic back problem going on. Once we get those going and they're activating and firing correctly, then we can start to build the core back up with some more spine neutral activities like planking, farmer's carries, more deliberate movements to really build up that strength. So that's all I got for you in the video. If you've been dealing with chronic low back pain and tightness for at least 6 months, you've seen way too many providers, and you're still having issues, then reach out directly to us to set up an injury consultation to get some real answers as to what is going on and get on the path to long-lasting pain relief so you can stay the hell away from pain pills, injections, and surgeries that only make things worse. All the information to request a consultation is in our profile or wherever you're consuming this video. I appreciate you watching, and we'll see you on the next one. Bye.